Yoni, owner, founder of True Sports Physical Therapy, and he works constantly, for those that don't know, with all athletes, but specifically works with the high-intensity pro athletes in football, baseball, you name it. He handles it. Yoni, how are we doing today?
Thanks for having me back, Ryan. Good to be here.
Yeah, you're damn right we're back. Well, let's talk about this. Let's get into it because Orioles news and injuries, that's what's on people's minds. I feel like almost every single day. And let's start with the first one, which is the last time you and I talked. That was Grayson Rodriguez. And you were right spot on with that lat injury, lat strain. The good news is they believe Grayson's going to make his way back to Baltimore, hopefully by the end of September, which would put him right at the minimum of 6 weeks to be ready to go. So he's throwing off a mound, which we've heard. So talk a little bit about, in your mind, what could be some hurdles here before Grayson finally gets the green light?
So ideal scenario, he's going to have a few starts to ramp up. That is not the case now because, Rye, as you pointed out, Norfolk's wrapping up, so minor leagues are just about done. So he hopes to maybe get one rehab start before he's major league eligible, and then there's no one else for him to pitch. So I think what the Orioles have to do now is do a really good job of simulating game-type scenarios so that they can make sure he is indeed ready when he gets back onto the mound. By the way, that is pitching off a mound, but it's also ways to mimic it in the weight room. So ways to load the arm, make sure that his arm is caught up, that he's taken a month off now from throwing off of the mound. So just to make sure that everything is moving properly so that when he hits the mound, end of season, maybe early postseason, he's ready to roll. So I'm sure the Orioles are checking all those boxes as we speak.
And obviously it's a guy that we've talked about before, Yoni, that has dealt with a lat injury in the past. And we know you even said they're just a pain in the butt, because there's so many different layers of it. But realistically here, as far as being comfortable, and I was just looking at the video right now of Grayson throwing a bullpen session. In your mind here, as far as when it say he, it was a mild, low grade strain. Then hypothetically, if we're looking at the end of September, can he feel like he's almost 100%? Like hypothetically, Grayson can be as close to as healthy as he possibly can be?
Yeah, I mean, theoretically, he's going to feel good. The question I have is how many pitches does this guy have in the tank? It's totally different rehabbing to be a starting pitcher, which is where they need him. God knows they can use him at the back end of the bullpen as well. But those are drastically different from an arm load perspective. So if he comes back for a start, a big league start, end of the regular season, early postseason, I would expect some type of pitch count. You got to be careful with this guy because he hasn't had time to ramp up and really stretch himself out.
Yeah, and it's a great point you make, is that just because we just saw Zach Eflin go on the IL really quickly is actually coincidentally what Grayson did earlier in the season. Went on the IL, and as soon as those 15 days were up, he was back out pitching, didn't have a rehab assignment. But for Grayson Rodriguez, for going back to his game logs, Yoni, hasn't pitched since July 31st. So to your point exactly, that's a buildup there. So the Orioles are going to have something to figure out as we move closer. But at least on the positive side, as Birdland fans already know, Zach Eflin's pitched tremendously. Albert Suarez is on the bump for the Orioles in the White Sox-Orioles finale here in Baltimore. And then Corbin Burns, even though people are jumping up and down, still a really damn good pitcher. But Grayson can make this staff better. Let's go to the bullpen then. You talked about how Grayson, obviously, if he's limited, could go to the back end of the bullpen. Let's talk about two guys, but let's start with one. Jacob Webb was a guy that had some inflammation, specifically in his arm. It looks like he's going to be coming back to Baltimore soon. And if there's no hiccups there, and I know it's pretty vague on, the quote-unquote inflammation, but clearly, if you're able to get back and you're throwing rehab games, the inflammation has subsided. Is that a fair assessment?
That is a fair assessment. Here's what's interesting with Webb, and I hate to be glass half empty.
Yeah, no, you don't. You do this every time.
So only because I've seen a billion of these. So Webb had elbow inflammation, right? Which is a catch-all term. We don't really know what that means. It means his elbow was hurting him. Webb had a surgery, I think, in 2019 for posterior elbow impingement. So that's where the bones of your elbow bang into one another in the back. He had that cleaned up surgically, came back really strong. He's had a nice run since then. Mm-hmm. There is a high correlation between posterior elbow impingement surgeries and UCL issues. Now, it is important to note that the Orioles didn't list him as a UCL strain or anything UCL related, but the elbow's structure is compromised once they go in and shave out a piece of that bone. That does tend to lead to this elbow inflammation. So I'm not surprised to see it pop up. It's awesome that they calmed it down. I think it's a good short amount of time between now and when the Orioles win the World Series this year. But just something to keep your eyes on that, hey, he's kind of has one of these predictors for elbow injuries moving forward.
So with that being said, thank you again for being glass half empty here. Everyone on Twitter especially knows I like to try to stay more optimistic, but I do appreciate it.
Yin and yang, Rip.
That's why we work so well together. But for the most part. But context here is it's a very delicate situation. But Jacob Webb has been a pitcher for Baltimore where he has really found himself. I mean, he's been very solid. He had a really great start. Yes, just like every pitcher, had his moments of struggle, but he looks like a guy that you definitely want in your bullpen here down the stretch. And another guy we talked about earlier, Yoni, that's had a little bit more, I wouldn't say it's complications, but because specifically he had surgery or had the bone chips removed, and that's Danny Coulombe, who they are getting optimistic about. Right now, the timeline, nothing really has fully changed. Besides that he got to face some batters the other day, he's throwing off a mound. Walk us through that process now. It seems like he's cleared certain hurdles. What else does he have to clear here before you feel good about where he is and getting back on the mound in the big leagues?
Well, I think he obviously seeing some live action is awesome. And I think that's important to note also. You can see Grayson throwing his pen on Twitter, and the guy looks like he's going about 50% effort. Once you put a batter up there like Coulombe's going through, it's just a marker of, hey, that's another hurdle to cross. So that is a great reason to be positive on Coulombe coming back. And I think that's why they're so optimistic that he's already seeing some live action. I would want to see him just see how many pitches can you layer on top of one another and how do you recover, right? And specifically in Coulombe with a guy who's going to pitch back-to-back nights, how does he bounce back from that? So seeing it once is awesome. What does he look like on back-to-back pens or something like that? I think that'll give you more. There you go. Look at the balloons flying around. I mean, everyone is positive on Coulombe coming back.
Well, everyone's getting excited about it now, Yoni, right? There it is. But I think the one thing I really took away from you right there was the next day, the next outing, the next bullpen session, because it's that extra repetition, especially for a guy like Danny, which you hope you can use him, frequently, regularly. Is he going to be able to do that? That was something that the Orioles counted on because of the fact of his success. I mean, he's 2.42 ERA on the season, and the Orioles at the time when him and Jacob Webb were put on the IL, and actually Danny Coulombe beforehand, Orioles did have the fourth best bullpen ERA in the big leagues, and a big part of that was a guy like Danny Coulombe who Brandon Hyde literally didn't matter. Bases loaded, extra inning, sixth inning, ninth inning, didn't matter what happened. Danny was getting in the game and was having success. So we're excited about that. Let's switch away from pitching here, Yoni. We understand where that all stands at the moment. But let's talk about then a player where earlier in the season, so many fans were saying, hey, get this guy out of here. I didn't agree with that. That's just what other people told me. It was a guy that knew his role, and when the time was needed for him to step up, he would be prepared. And I'll tell you what, he was so damn hot and on fire and really firing on all cylinders for an offense that was struggling. You guys can probably take a guess. It's Ramón Urías. Now he's on the IL. And we know he's has an ankle sprain. He was on crutches. And Yoni, you know I'm cringing because I've had my ankle injuries. Right now, it's just a 10-day IL. But you and I both know the ankles are so tricky. And the fact that he was still on crutches doesn't seem like it's something that is an immediate answer that he's going to get back. But maybe touch on of what Ramón has to face here in order to get back to helping the ball club.
Yeah, I mean, the big thing is how rapidly he can start working on lateral motion. So how secure is he moving side to side? Obviously, that's super important for an infielder. And I have far more comfort that he's going to be ready rapidly because I think these ankle things can go quickly. And you can get up to a major league level and perform at a high level while you're playing, while you continue the rehab process. Different than an arm. Like an arm, you got to check off every single box, be 100% by the time you get on there. I think we can look forward to seeing him sooner rather than later, as opposed to the arms where we really want to take our time. How's that for glass half full?
That was nice.
That was positive.
How did that feel? You know?
Felt good. Thanks, Rip. Thanks for teaching me that.
That felt great. And that is the part of it, at least in this sport, in this situation. So many things, at least not compared to pitching, but for ankles or whatever thing else, there is a pain tolerance that you can handle. How stable is the ankle is the biggest thing. I remember going through so many of those physical therapy sessions of trying to gain strength back. So for Ramón, it is something you hope it's sooner than later. It's a guy that definitely was solidified now. The Orioles have had the next man up. Manuel Rivera has played well. Kobe Mayo has been back up, even with limited opportunity. So I'm glad you can touch on it. And Ramón, who would have thought that Ramón Urías over the last 3 weeks would have been one of the, if not hottest hitters for Baltimore. And that's definitely one that we are going to monitor. I think that's the big injuries, except there's one more here. And I saw
one more quick point, Rip, is just around the ankle is you're talking about a joint that is braceable. So different than elbow and shoulder, right? So if they can get him in a brace and they can, how do I stop the balloons, dude? If we can get Urías in a brace, so you can tape him, you can put him in a brace to add external support. So it's not just the balance and stability exercises. I just think that should give Birdland some more hope that he'll be back quick.
Yeah, and that's actually what I'm glad you're saying. There is a big difference, big difference. And I think that's the point we're trying to emphasize. And yeah, there's nothing ruling out there with Ramón and ankles. You have a better idea of what timelines can be. Like I said, the arms can be a little bit more, fragile, to say the least. Fragile is a good word. New to the channel, like and subscribe button here. Talking Orioles injuries here with Dr. Yoni Rosenblatt, True Sports Physical Therapy. You got a question about an injury, you're looking for help. I'm not kidding you when the guy knows what he's talking about here. And even when I don't want him to be right, and I know he's going to be right, but it's better you guys hear it from him, so I'm not the bad guy. One other newsworthy injury part before we'll answer a couple questions here was Heston Kjerstad. It looks like he's going to start a rehab assignment soon in the minor leagues. That's what Brandon Hyde said. The reality, and you touched on this, talk about something that can be very unpredictable, concussions. And Heston clearly has had some effects that have impacted him. I'm going back now to that series against the Yankees was right before the All-Star break, and he's still trying to find his footing. This has to be a positive, though, that they're saying, hey, you've cleared this one part. We feel comfortable enough. But there should be a little bit of hesitancy, correct? Because you've dealt with players that have dealt with concussions, and they have long-lasting impacts.
For sure. And by the way, specifically in baseball, we might have touched on this last time, but the amount of tracking you have to do in baseball on a very small object like the ball, and the way you have to follow the ball past the backdrop of the stands. So it's got to move through all those fans. Then it comes up into the lights. Then you have to track that ball as you're moving. All of those things are a concussion nightmare because you're dealing with changes in backgrounds, and your brain has to understand where that ball is, and it's competing with light, which we know the body becomes very sensitive to following a concussion. And then you're competing with a moving background of the fans, and your body's moving. It's a nightmare to try to rehab that. So it is an awesome sign that they're putting him back in a rehab assignment. He's going to be able to work through all of those nuances of lighting factors, of tracking an object while he's moving, and the fuzzy background of the fans and the stands. So it's a great opportunity to work on that and see how he bounces back. But it's highly unpredictable. I wish I had a better timeline of, hey, 2 rehab starts and he'll be ready.
Well, you gave great examples, because even right now, I'm trying to find my bat. It's on the ground here. I'll pick it up. There we go. It's like, but so, Yoni, essentially you're right. I mean, for a hitter, if I'm looking at the camera here and all of a sudden, though, you're not even thinking about, well, one, you should be thinking about, if you're trying to locate a ball and trying to see what the movements are, what's the speed, what's the location. And then on top of it, you have then the back layers of whatever you're not focusing on, but you can see whether it is the backdrop that's there, whether it's the pitcher or the center fielder that's way in the background, and you don't know how your mind's going to react is kind of what you're saying. You're hoping it's moving in the right direction, but that's where people get hesitant, is how do you react? But like you said, Heston is moving in the right direction. They obviously feel better that he's going out there to get at bats. Now we just hope that Heston feels good, because concussions just have so many different variances. And in a sport where you really need to have control, and it's different. I know that concussions, vertigo, different circumstances, Yoni, but still the same thing. If it's messing with your hand-eye, obviously it's going to be really damn hard to play the game of baseball.
Yeah, and I think the example you give with the bat is the simple example. I'm more worried about what he looks like in the field when he's got to track a fly ball. I mentioned all the visual disturbances that transpire while you're trying to track a fly ball. The other thing is, we know concussions have difficulty with increases in heart rate. So as you're going to chase a fly ball, your heart rate elevates. That actually messes with your depth perception and what transpires around your eyes. That's where I'm more concerned. So I'm sure he's been shagging flies. It's totally different when it's bottom of the ninth and 2 outs and that ball gets popped into the outfield. Now you're tracking. Now your heart rate's elevated. You're sprinting. That's what I'm worried about. That's what he's going to be working through while he does his rehab assignment.
Well, and the Orioles obviously would love him back. But again, does he get to have that magic that he had? And hopefully the biggest thing above all is that Heston Kjerstad is healthy and feeling better. That's what we want first. And secondly, being able to help the team. Another guy, actually, God, there's so many injuries, so many things here. You know, it's unbelievable. But Jordan Westburg was starting to throw, and obviously this one's a little bit more, maybe of all the situations here, is a little bit more cut and dry, because – and I'm trying to find the specific bone that was broken, or with the hand for him. Or what was the bone? I just had it up right here. And of course, technical difficulties for me. Just had it here. Tomato. Come on. Can't find it. But what we do know is, we'll just throw this around. He's taking grounders with his right hand fracture. It's not giving the specific on it, but that's a little bit more cut and dry, Yoni. They said they hope to get him back right around the postseason is the goal. And with fractures, especially if it's a clean fracture, where you're not having any complex situations, you don't have to get surgery. You just got to let it heal. And if that goes properly, Jordan Westburg should be ready on the timeline that they've been putting out there.
Yeah, what's nice about that is you can see it on X-ray. Hey, it's getting better, or it's not. It's the exact opposite with Kjerstad, right? You can't image a concussion and see how well they're doing. So I think the future does look bright for Westburg, because they'll be able to tell quickly, hey, it's healed. Okay, you can push through some discomfort. Let's get you back on the diamond.
See, and there it is. And Jordan Westburg is a guy, honestly, when the Orioles were having some offensive struggles, he was one of their best situational hitters with 2 outs, runners in scoring position. Obviously, to me, is a really solid overall player, good defensively. It's a guy you want in your lineup. And then there's Ryan Mountcastle that's dealing with a sprained wrist. So talk to me about with sprains compared to fractures here, because it's the same concept. How extreme is the sprain here? But how quickly or how long could you expect with Ryan Mountcastle? I assume it's going to be on the quicker side, but that's where things can be a little bit more. I want to be a little bit more cautious because of that. The situations that we talked about with even with ankles, how bad is the sprain?
Yeah, and it's a little bit of you can't brace a sprain of a wrist the same way you can of an ankle, right? So you have to have a little bit more motion at the wrist, especially playing baseball. They've come a long way with imaging of ligaments, so they're able to see the degree of sprain, how well it's healing. But a lot of times that pain will stick around. But if you got good medical coverage, they'll be able to say, hey, it's just like with the fracture. It is healed. You can push through a little bit of discomfort. You'll also see that show up on the rehab side where the Orioles are able to load those ligaments a little bit more aggressively once they kind of get the clearance from the imaging, from the ultrasound imaging or MRI imaging, to see how well that ligament has healed itself back together.
Yeah, and that's the part of it that I'm glad you bring that up with it, because the intricacies of how it all is. In some cases, you might think that, hey, it's simple, or why isn't it this way? But some cases you really don't know, like you just mentioned, when it comes to brain situations or injuries, that's hard to really tell. But when it comes to fractures, when it comes to sprains, you can get some immediate results about feedback is what we want to talk about. So at least on that sense, doesn't seem like a long or a big concern, but obviously the Orioles, it's crazy, Yoni, how banged up they've been and where they are right now. And still, what I try to tell people, a lot of teams with this many injuries, they wouldn't be where they are, which is 81 wins, first in the American League. They are that talented, they're that deep, and hopefully they get healthy enough down the stretch